Try to clear. There you go.
You ever wonder what happens to an adult who has persistent middle ear fluid after weeks of being treated for a viral upper respiratory infection or bacterial sinus infection? These patients need to see an ENT provider where they may require a myringotomy or opening of the tympanic membrane. Here we are, anesthetizing the posterior inferior of the tympanic membrane with phenol. You can see the white blanch, which means the patient's anesthetized at that portion of the TM. Now here we come with a myringotomy knife, making the opening. And as soon as we make the opening, you can see some of the bubbles move. And that just means that the fluid and the pressure is being released. Eventually we will come through with a suction to evacuate the fluid. Remember, any adult with unilateral middle ear fluid needs to see an ENT provider for nasal endoscopy to rule out a nasopharyngeal tumor or cancer. Also, if this fluid persists, the patient may eventually need a myringotomy and evacuation of that fluid. All right, so here we are. After we made the opening in the eardrum, here's my suction, and we're going ahead, and you can see the evacuation of some of that fluid. You see the bubbles kind of moving around as we're suctioning it out. And then after a while, I wanted to try to get more fluid out of there, so I had the patient give me a Valsalva maneuver, or auto-insufflation, and there's all that fluid coming out. That's all clearing out the middle ear and coming through that opening. You can imagine that after this, she was feeling much better and had much better hearing. If you like this content, please like, subscribe, and share to help us grow. Also, for more content like this, please check out our courses for APPs, medical residents, APP and medical students at compassiomedical.com. We'll see you there.